Hi there. Why should you choose intravenous ketamine as a treatment? Well, I'm going to show you how ketamine works within the body. Doctors were looking for a new anesthesia that did not suppress respirations. Ketamine provided a state of unconsciousness as a kind of trance, resulting in a dissociation from the environment. On EEG, which is a device that measures the electrical activities of the brain, delta waves of the brain appeared to be related to the analgesic effect. The analgesic effect is the pain effect. Delta waves are the slowest recorded brain waves in humans. Delta waves were associated with the deepest level of relaxation and restorative sleep. Delta waves are primarily seen in those with brain injury, learning problems, the inability to think, and severe ADHD, attention deficit hyperactivity disorder. This mechanism possibly could be a direct clinical dissociation or block of the thalamus. Delta waves of the brain appeared to be related to the analgesic effect. So, what is the thalamus? And what is the thalamocortical path? The thalamus is your body's information relay station. All of the information from your senses, with the exception of smell, are processed through the thalamus before the information is sent to the brain's cerebral cortex for interpretation. All motor information are relayed through the thalamus. Your thalamus also plays a role in sleep, wakefulness, consciousness, learning, and memory. Cerebral cortex lying right under the three layers of membranes known as the meninges. So this is what the thalamus looks like. Ketamine. Ketamine is overseen by the U.S. Drug Enforcement Agency, better known as the DEA. Prescribers and dispensers are required to have a DEA license to prescribe or distribute these drugs. The licensing provides links to users, prescribers, and distributors on each medication. In 1999, ketamine was changed from a Schedule 1 to a Schedule 3. Schedule 1 drugs include heroin, LSD, and ecstasy. Ketamine was reclassified to a Schedule 3, which includes non-narcotic substances under the Federal Comprehensive Drug Abuse Act. So what does ketamine look like? It comes as a clear liquid and a white or off-white powder. The powdered ketamine comes as 100 milligrams to 200 milligrams, typically packaged in small glass vials, small plastic bags, or capsules. The use of ketamine as treatment for mental health came along as a result of chronic pain patients describing an improvement in their mental health while getting ketamine for their pain. At first, it was thought that the decrease in pain was caused by the decrease in pain was causing the improvement of the person's mental health. So ketamine was studied as a treatment in people without pain to assess their mental health after ketamine. They found ketamine effective for patients whose mental health hadn't responded to traditional medical treatment. So, how does CRPS affect the nervous system? It is believed that CRPS occurs as a result of dysfunction in your central or peripheral nervous system, your CNS. Initially, it was thought that CRPS affected only the sympathetic nervous system, which is why it formerly was referred to as reflex sympathetic dystrophy. The central nervous system consists of your brain and spinal cord. The peripheral nervous system relays information from your brain and spinal cord to your organs, arms, legs, fingers, and toes. Your brain is like a central computer that controls all the body's function. Your brain is in control of what we think, how we feel, as well as how we learn and remember things. Your brain controls the way we move and talk. Your brain controls things that we are less aware of, such as our breathing, the beating of our hearts, and the digestion of food. Your brain sends signals back and forth with the body by way of the spinal cord. So this shows how the brain and the spinal cord relate to one another. Glial cells are the main component of the brain. Glial cells are the packing between the nerves. Glial cells make up 80% of the brain, and glial cells are the glue that holds the nerves together. This is what a normal glial cell looks like. It's the blue packing between the branches of the nerve. When pain signals from CRPS are prevalent, it activates the glial cells. The activated glial cells look like this. Inflammation is caused by the glial cells. Continued pain signals up to the brain cause the glial cells to release a chemical called cytokinins. These angry glial cells that produce the cytokinins are what causes the inflammation associated with CRPS. Angry activated glial cells release cytokinins. Cytokinins are a broad and loose category of small proteins important in all cell signaling. Cytokinins exert their functions by interacting with specific cytokinin receptors on target cell surfaces. A deficiency of cytokinin receptors has been directly linked to certain debilitating immune defects. And this is the release of the cytokinins. So, angry activated glial cells release cytokinins. The cytokinins are a broad and loose category of small proteins important in cell signaling. The cytokinins exert their functions by interacting with specific cytokinin receptors on a target cell surface. NMDA receptors. Within the brain, N-methyl D-aspartate, which NMDA is the abbreviation, receptors act as a neurotransmitter. When the NMDA receptors are activated, it opens the ion channels. The opening and closing of ion channels is primarily gated by ligand binding. Ligand binding refers to the process where small amounts of radiolabeled drugs selectively attach to specific sites in the body due to their high affinity and vital creation being saturated. NMDA receptors are the regulators of the current that flows through the ion channel and is voltage dependent. Ligand binding electively attaches to specific sites in the body due to their high affinity. These channels are specialized protein in the plasma membrane that provide a passageway through which charged ions can cross the plasma membrane down to their electrochemical gradient. Ion channels. The resulting ionic current is registered by the movement of charged ions through the membrane channels. The ion channels are responsible for the electrical excitability of muscle cells. The ion channels mediate most forms of electrical signaling in the nervous system, which might contain 10 kinds of ion channels or more, located in different domains of its plasma membrane. A single neuron might typically contain 10 kinds of ion channels. The ion channel acts as an orchestrated manner to give controlled cellular contraction. And when it's open and then voltage gated closes it. NMDA receptors on a cellular level, pain signals are sent from the affected area. For this discussion, we'll say the right foot. As these pain signals barrage the brain from the foot, it causes the glial cells to activate. This activation causes a release of cytokinins, causing inflammation to travel down to the foot. Within the brain are NMDA receptors. The NMDA receptors are activated, changing the current flow, which also affects the foot. So, what does all this have to do with ketamine? CRPS causes inflammation. By looking at the nervous system on a cellular level, we can see how ketamine can help the inflammatory process. Ketamine is an NMDA receptor antagonist. Receptor antagonists inhibit the action of the NMDA receptor. NMDA receptor agonists include a state of dissociative anesthesia that is marked by catalepsy, a medical condition characterized by a trance or seizure with loss of sensation and consciousness accompanied by a rigidity of the body. Amnesia, which is memory loss, and analgesia is the inability to feel pain. Dextrorphan is a metabolite. A metabolite is a body byproduct when the body breaks down a drug. It is a metabolite of dextromethorphan, which is also an NMDA antagonist. Dextromethorphan is commonly used as a cough suppressant. Ketamine is also an NMDA receptor antagonist. Ketamine and NMDA receptor antagonists suppress the NMDA receptors, restoring the current flow between the nerves. Ketamine infusions have very few side effects when compared to other treatments. With every treatment, we must weigh the risks, which are the side effects, versus the benefits. The benefits of ketamine are it directly impacts our CNS, central nervous system. None of the other treatments used in CRPS actually act on the central nervous system. Ketamine reduces the inflammation and restores the current flow. Side effects are nausea, which is treated with an antiemetic, which is a nausea medication. For the first 20 minutes, ketamine can cause an elevated blood pressure and heart rate. Therefore, clonidine is given usually 30 minutes before the infusion to prevent this. Possible hallucinations. Versed and Ativan are often given before and with the ketamine to keep you calm. And agitation. Also, the Versed and Ativan can help reduce the risk of agitation. So you've decided that ketamine is the right treatment for you. When you're choosing a physician to treat your CRPS with ketamine, you need to ask the following questions. Do you have medications on hand to treat high blood pressure or high heart rate? Do you have oxygen available? Do you have emergency protocols? If yes, what are they? Who is monitoring the patient? It should be a nurse. How do you monitor the patient? Each patient should have a cardiac monitor. The patient's heart rate and respiratory rate should be monitored, an oxygen monitor called a pulse ox, and a blood pressure cuff monitor. You also need to find out from the ketamine provider what dosage they use, and do they use the associated medications that I have mentioned, such as Zofran, which is anti-nausea, Versed and Ativan, which help keep you calm and have less hallucinations, and clonidine to help moderate your blood pressure and heart rate. Typical protocols. This is outpatient IV low dose. Low dose for CRPS patients is between 250 and 300 milligrams given over a 4-hour period. Anything less than 250 milligrams is considered not therapeutic for pain patients. If this is your first time getting ketamine, you need to have a loading dose. The loading dose typically consists of consecutive days, Monday through Friday, given over 2 consecutive weeks. Frequency and dosage affect the benefits of ketamine. High dose IV ketamine. High dose for CRPS or pain patients is anything over 300 milligrams given over 4 hours. If you're new to ketamine, you still need a loading dose with high dose. This typically consists of consecutive days, Monday through Friday, into consecutive weeks. In addition, with high dose, most physicians start you out low. If you've never had ketamine before, they want to see how you react to it and gradually increase the dosage until they have reached the desired dosage. Inpatient ketamine. At this time, I personally don't know of any practices in the United States doing inpatient, but that doesn't mean that they aren't. This is often done in the ICU, intensive care unit. Your heart rate and rhythm are monitored. Your respirations are monitored. Your blood oxygen saturation is monitored. And you are medicated with Ativan, Versed, Zofran for nausea, and clonidine. Inpatient ketamine dosage starts at 10 milligrams per hour. The ketamine is slowly increased by 10 milligrams every 1 to 2 hours. The staff is looking for you to have a nystagmus, which is an involuntary shaking of the eye. They are also looking for you to feel tipsy. Once these two things have occurred, the nystagmus and the tipsy feeling, that is the dose that will be maintained for 5 to 7 days. At the end of the 5 to 7 day period, the ketamine dose will then be gradually weaned off. Other forms of ketamine. In addition to IV ketamine, it is compounded into other forms. Ketamine troches. This is a lozenge that is dissolved between your back teeth and your cheek, right here. It is absorbed buccally. Extended release capsules. These are compounded capsules in various strengths. But oral ketamine only has a 20% absorption rate. There's liquid ketamine. For some, it's mixed up with the flavoring, but basically it's the IV ketamine taken orally, and it can be given by nasal spray. I want to talk for a minute about the Matthew Perry effect on ketamine. Once it was determined what his cause of death was, it has caused many providers to stop prescribing at-home ketamine, meaning these troches, extended release capsules, nasal spray, or liquid. When used properly, they are all very safe. In Matthew Perry's case, he was not using it the right way. He was doing injections of IV ketamine and taking amounts in other ways far exceeding what is safe and normal. So it has also caused the DEA, the Drug Enforcement Agency, to look very hard at ketamine clinics to make sure that they are maintaining the standard of care. Lastly, it has had the distributors decide to cut off IV ketamine from any physician who is prescribing at-home use of ketamine. Therefore, you will find that fewer and fewer physicians will be prescribing at-home use of ketamine.